So when you're mobilizing hip internal rotation in the 90-90 base position, it's very common to find pain in two very specific areas. Number one, you'll come across pinching in the hip joint, especially if you have a very strong capsular limitation. And two, you'll feel some pain in the knee when you're trying to mobilize into that internal rotation. So both of those stem from that tightness in that capsule, in the joint, but there's a very easy way to go around that. Now, the reason you're feeling a lot of stress in the knee has to do with the fact that the limitation in the hip is causing a lot of the load or force you're creating when you're rotating back to go through that medial knee joint. And that's where you feel a lot of almost like that gapping in that joint line, and where a lot of people will feel that limitation. Now, specific to the pinching in the hip, when I rotate back and I try and mobilize into more internal rotation, you can see that my knee almost kind of travels back along with me. So as I do that, I almost go into a slight hip flexion, and when I do that, I'm actually closing the space off in the joint even more. So if you're already limited in how much range of motion you have in that joint capsule, you'll feel or run into that pinching a lot sooner than if you had way more range of motion. The 90-90 is also not as forgiving for a lot of people, especially if they have limitations in both external and internal rotation. But I'm going to show you an easy way how to apply a traction or distraction force in order to create a little bit more space in that joint capsule to get a good mobilization without running into pain in the knee or the hip. So just to review that little motion that was happening when I rotated back. So if I rotate back towards my trail leg, my knee wants to kind of slide back and go into slight hip flexion. So what I do is I'm going to take my hand, so I'm going to make sure my outside hand is a kickstand for me to create support. I'm going to take my other hand and I'm going to take my palm and I'm going to put it right behind my knee, really high up on the calf, just really close to that joint line. And what's going to happen is I'm actually going to create a physical block. So if I rotate back, now that knee is going to have to fight against the force of my arm in order for it to slide back, which I'm not going to let it. And so as I do that, because I'm blocking my knee from sliding back, and as I rotate and drop my hip towards the ground, I'm actually creating a traction or distraction force at the joint. So you'll notice, number one, that takes away the stress of this long lever, kind of imposing that strong load through that medial aspect of the knee. Number two, that distraction force helps me create a little more space in that joint capsule and go deeper into that mobilization. So I feel like I can actually go deeper into this stretch because of the space I'm creating by creating this block. Now you can even, because of this block, and because of the extra space you have access to now, you can actually go into more hip extension by just sliding the hip forward, and that allows you to bias the hip capsule even more by extending and loading the anterior aspect of the hip by going to more hip extension. So this allows you to mobilize that hip joint while being in less of an extreme position or a closed off position. And it allows you to move a lot less in it too. So I'm actually very, very well supported. I feel very comfortable. And the more I push with my hand or this block, the more space I'm able to create. So that's how you go around that knee pain in the 90-90 when mobilizing into hip internal rotation, and how you can go around some very strong capsular limitations that might be preventing you from actually using the 90-90 for internal rotation. So give it a shot and let me know what you think.